After a mostly quiet summer, COVID looks like it's making a comeback right now. Upstate Global Health Director Dr. Stephen Thomas is going to join us to update us on this increase in cases. Dr. Thomas, always a pleasure to have you. There he is. Thanks for being with us. Appreciate it.
Thanks for having me. Good to see you.
So I'm hearing there is a significant COVID uptick, if that's a fair characterization. I don't know what words you want to use. What's going on? How do we know this?
Yeah, well, you know, the West and the Southwest and the southern states have been dealing with this for quite some time, and you know, we were all hopeful that it wasn't going to make its way up to the Northeast, but it has. And so, you know, what we're seeing is that the percent of people who are coming to clinics and emergency departments that come with symptoms that test positive for COVID, that number has been steadily climbing for the last couple of weeks. We're also seeing increased numbers of people needing to be admitted to the hospital because of COVID infections. You know, unfortunately, nationally, we're still seeing about 300 deaths a week due to COVID, which, you know, we sometimes forget what the ultimate price is of these infections. And we're also seeing some relative increases in terms of viruses that is being identified in the wastewater all throughout central New York. So yeah, all the data points to the fact that this virus is unrelenting.
Why would you say it is happening now at this point all of a sudden?
Yes, I think it's multifactorial. The first is that it's been a while since people have been vaccinated or have received their seasonal COVID vaccine. So immunity wanes over time, right? The protection wanes over time. The other is that people who have been naturally infected and had some level of immunity, that's also decreasing because we went through a period where there was a pretty significant lull in the number of infections that were occurring. The third thing is that we now know that, you know, the two major variants that are circulating within the United States, these KP3 variants, they are relatively new, and so the immunity that we've had may not be a great match. And then finally, people are gathering, right? It's the summer. It's what we do, and so. There have been a number of reports of people going to conferences and going to concerts and things of that nature, and then flying, you know, on planes and then coming down with COVID shortly thereafter. So I think all those things are contributing.
Yeah. Where would you say this goes? How long will these numbers keep going up? Do we wait until like a vaccine in the? Where do you see this going?
Yeah, well, you know, the word on the street is that the vaccines are going to be available. The new formulations will be available. So this would be the 24-25 season. They'll be available in September, hopefully early September. The guidance was, to use the analogy we discussed last time, you know, the trunk of the tree is this JN1 variant, and the current variants that are circulating within the U.S., including here in central New York, these are branches that come off of that trunk. They've directed these vaccine developers to target the trunk. So the hope is that when they make these new formulations, we're going to get good protection against what's currently circulating. So, I mean, to me, that's probably the biggest intervention that's going to be made and be able to impact what's happening now, other than people taking their own personal risk assessment and deciding when they're going to wear a mask. Are they going to avoid certain gatherings? Are they going to test themselves? These types of things.
Yeah, that's what I was going to kind of ask you. Until those vaccines are available, hopefully early September is obviously about a month away, but it's still a month away. So what do you do in the meantime, basically?
Yeah, you know, it's the same game plan as from day one of this thing, which is to know yourself, know if you're in a high-risk group. Are you over 65? Do you have significant medical problems such as diabetes or chronic kidney disease, heart disease, lung disease, et cetera? Know what situations might be of high risk, which would be large, highly densely populated areas or venues or events, and take precautions if you have to go into those high-risk situations, which would be, you know, wash your hands religiously and wear a mask, and that's the best thing that you can do.
Dr. Thomas, you know, we always appreciate having you on, and certainly with these updates, my guess is this continues. We'll be talking about this again with you really soon. Thanks for being here tonight.
Yeah, thanks for having me.